I think if you start at the top level, there's two ways to approach it. So we can look at the almost the human impact of data and how we can use data to improve outcomes for citizens, be they patients, service users, victims, but also how we can use data to make the day job of our hard-pressed public sector staff that much easier and enable them to be even more effective in their roles. So it's really, really important to consider what the value is in that context. But one of the areas that we've been giving a lot of thought to recently, as we start to see more and more demand for support with regards to getting more value out of data, is how do we put data as an asset on the same footing as some of the other investment priorities that public sector organizations have. So if we think about pre-COVID, there were a series of systemic challenges. Demand tended to be going up, resources were either flatlining or in some cases coming down, and trying to bridge that gap has been pretty much the most vexing challenge, I think, facing public services. And so on the face of it, then there are a plethora of different investment priorities that any decision maker could choose. How do we get data, instead of being the poor relation at that party, how do we get it up towards the top tier of things that organizations might choose to back in order to meet that challenge of, effectively improving outcomes as we started this with, and trying to do that in the most cost-effective way in resource-constrained times. So in terms of the four methods that we've landed on that we find tend to work quite well in terms of articulating the value in data, the first one to think about is the cost value. And by that, I mean, how much does it cost us currently to look after, manage, protect, store, and then actually analyze and exploit our data to drive an actual outcome? And the reason for doing that is that until you understand that, it's very difficult to make an equivalent case for data in the same way as you would, people or IT. If you think about those areas of any organization, there's a transformation every couple of years because organizations are looking to drive more value from their investment in those areas. And until we understand the cost related to how we manage data as an asset, then it's quite hard for us to be able to baseline and determine improvements in the value that we're able to drive over time. So that's one area. I think the second area is, loosely put, the economic value. So that actually ties together the two strains of thought in the sense that if you can put a value on the outcomes that you're able to drive, whether that's creating more jobs, safeguarding the vulnerable, better management of acute care and then discharge into the community, if you can put a pounds and pence value on those things, then it's not implausible to be able to work backwards to changes that you might make to the way that you analyze your data, investments that you might make in the way you share data, for example, across organizations, and then be able to determine a sort of line of sight to the end outcome, which has a cost or a benefit to it, and the investment that you're going to make, which is another sort of method, if you like. If you can say that by doing X, we will see an uplift in Y of Y%, then actually, we can attribute some of that to what we've done with the data. I think a third method that we have seen some organizations experiment with, and this plays to my earlier point around monetizing data, is the market value. So what would, if you were to make this data available for organizations to procure, what would they pay for it? And we actually saw a study by Ernst & Young a year or two ago now that looked to do this for the NHS data assets. And they came out with a figure which from memory was around 8 billion, I think, was the sort of quantified pounds and pence value of the NHS's data assets. And the way that they came up with that was by looking at looking at mergers and acquisitions data and looking at what had been paid for record level medical data and then using that to extrapolate across the NHS. And it was quite a powerful piece of research, I think, in terms of underpinning some of the stuff that we've seen since, in terms of investment in the NHS data infrastructure, if you like. And then the final method, in terms of being able to put quantitative values on your data, is looking at the opportunity cost value. And what we mean by that is, if we loop all the way back to one of the earlier points in this blog, where you have data that's not managed properly, that's not protected properly, that's not well governed, that hasn't got good quality, typically you'll find that there is wastage within other areas of your business. So we worked with one public sector organisation where roughly 40% of their investment in a new technology platform, and we're talking a multi-million-pound investment here, was set to be wasted because they signed a fixed fee for the platform, but due to the data quality, or the poor data quality, they were only set to realize around 60% of the functionality. And that's, that really is quite staggering when you think about the challenges that the public sector faces at the moment in terms of budgetary pressures, to think that our data, if not looked after more effectively, can effectively prevent us from realizing the ROI that we expect from our investments. In my mind, that's a huge motivation to get on and do something about improving the way that we manage our data.